everyone. I'm Velvet Spicer, and I am the Communications Manager for the Rochester and Finger Lakes Region chapter of the Alzheimer's Association. Today, we're beginning what we hope is going to be a long and fruitful journey with Rochester Health Engagement Partners, a nonprofit that endeavors to educate and empower the African American community. Cynthia Adell is the CEO and founder of Rochester Health Engagement Partners. The organization empowers the African American community to lead healthier lives by giving them the tools that they need. She has more than 25 years of experience in the areas of community building, education, and outreach, and working with underserved populations. The Alzheimer's Association is a worldwide voluntary health organization dedicated to Alzheimer's care, support, and research. Our mission is to lead the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Our vision is a world without Alzheimer's and all other dementias. The goal of our partnership is to bring information and stories to those who want to learn more about Alzheimer's and dementia from the perspective of people of color. We realize that people receive information better from those who look like them and share some of the same experiences. Data shows that older African Americans are 2 times more likely than whites to have Alzheimer's, and they are less likely than whites to receive a diagnosis of the condition. They also are less likely to seek support and resources to assist them. So we hope that this partnership between nonprofits will help you find the answers you need and encourage you to get involved in whatever way you can. Here's Cynthia to introduce our first guest, Jackie Dozier. Welcome.
Thank you, Velvet. Hello, Jackie. Thank you so much for joining us for this conversation regarding Alzheimer and being a caregiver. I'd like to ask you, you are welcome. I'd like to ask you, how has Alzheimer's affected you?
My mom was diagnosed a few years back.
Okay, please tell me a little bit about your mother before she received that diagnosis.
My mother
What was she like as a person?
My mother was very outgoing. She was a missionary, actually. She loved people. She was a people person. She was always, lending a helping hand. She took care of us. She was a single mom for a long time. So we grew up with her and my grandmother in the household. And she was an OR technician at Genesee Hospital for many years. And then she moved over to Strong Memorial Hospital, where she retired from. But she was very outgoing. Again, she loved people, so she was always lending a helping hand, very active in her church. So she just loved people, very humble, proud person. Yeah, that's my mom.
I'm pleased that I had the opportunity to meet her in years past, so I can co-sign on what you're saying.
Thank you.
Definitely. So what changes did you notice prior to her being diagnosed with Alzheimer's?
So a few years back, we always spent Christmas Eve with my mom. So, grandchildren, siblings. Christmas Eve, we exchanged gifts at my mom's. And this one particular Christmas, we opened all of our gifts, and she had a comforter set that my youngest daughter bought her for Christmas. And everything seemed normal. And maybe an hour in, after everyone had opened their gifts and folks were just sitting around, watching TV and playing games, and she called me over to the table where she was sitting and said, "Who did you say gave me that comforter set?" And I said, "Oh, Mom," I said, "Ashley gave you that comforter set." I said, "Ashley." She said, "Oh, Ashley gave it to me. Oh, okay. So, things went on. maybe an hour later, just before we all got ready to leave and pack up, she asked me the same question again. Who did you say gave me that comforter set? And I told her, and I said, Ma, are you okay? And she said, yeah, I'm fine. I just I couldn't remember who gave it to me, but you said it was Ashley, right? And I said, yes. I got home and she called me again. She called me and asked the same question again. And I just proceeded to answer the question, knowing in my mind that there was something going on. But I just said, Ashley gave it to you, Ma. Remember I told you earlier when we were opening the gifts that it was from Ashley. Remember Ashley handed it to you? So I kind of tried to go back to the time and in real time what was going on. And she just said, oh yeah, that's right. Ashley gave it to me. And so that's really how my journey began with my mom. I had been a community partner with the Alzheimer's Association. And so there were presentations that were happening in our Black and Brown communities. And so at that time, I decided that I probably needed to go to one of those meetings to see what the difference was between dementia and Alzheimer's. And I did attend one of the meetings at one of our local churches. And out of the 10 points that identify dementia or Alzheimer's, my mom had 8 of them. And so it took me back. And then I had to start, then she started having flare-ups because she also has MS. So she started having some MS flare-ups. So a couple times she had gone into the hospital, and then I started to, talk to her primary care physician and say, hey, I think this is going on with my mom. I think she's got dementia. She's not remembering things. And it started to happen frequently. It was far and few in between in the beginning, but it was happening. And then it started to happen a little more. And then it was determined that my mom needed to have long-term care, not for the dementia, but for the MS. And so we needed to bring in aid service. She needed to have aids. And we had to then, after my mom working 37 years, had to then reach out to DHS for help, which was a tough thing to do. My mom did not like it. That was not something in my mom's age group, in her generation, that was not something that they did because they worked very hard. But she did not have long-term care insurance the whole time she was working. And in order for us to get the services that she needed, we needed to apply for Medicaid.
So it sounds like you were her advocate as soon as you started seeing the symptoms. You said that she exhibited 8 symptoms or signs of Alzheimer's disease, and that you spoke to the doctor on her behalf.
I did, yes.
Do you feel that the provider was open to talking to you about her health care?
Oh, yes. So what ended up happening, yes, I did a lot of advocating. It took me 2 years to get in a space that I felt that my mom was comfortable and that I can continue to live a normal life as well. And when I say that, like I said earlier, she needed AIDS care. And so I ended up looking around for different places that I could possibly get her in, like senior programs and things like that. And I ended up choosing Elder One, which is under the umbrella of Rochester Regional Health, where there, all of her care needs are met in one space with the exception of any specialty, um, doctors that she needed to see. And so with their help, we were able to get home health care for her. So they are kind of like one-stop shopping. And so, which was really good. They have a senior program where she still does, she goes out 4 times a week to the senior program. Her primary care doctor is on site, her case manager is on site. So the challenge really was getting to that point, and being able to get those services in place for my mom. So that was what literally took 2 years. And for me, who is someone that is in the healthcare field, the navigation that I had to go through to get, the services that my mom needs, it was tough. It was tough. It was really, really tough. Our system is just not built to make things easy. So.
I understand. And as you were speaking, I was thinking about how well connected you are to the community, and you have a plethora of resources available to you. So as you were speaking, I was thinking about people who are not well connected in the community and the challenges that they have to face, dealing with their mother's diagnosis of Alzheimer's. It has
I
to be
agree with you.
extremely challenging.
Yeah, I think about that all the time. Like, and even, in the midst of advocating for my mom, I would say that to people like, my God, I know people, right? I can't imagine what other people who don't have the resources and don't know where to find the resources go through, because it was very challenging experience for me.
Definitely, I'm sure it was.
Yeah.
So you said that you had to get her home health care services. What other services or assistance did you need to obtain?
So honestly, again, like I stated, like she has her whole medical team is in one space, with the exception of her multiple sclerosis doctor. But all of her services are right where she is. So that actually has been a blessing in itself. Other services, I really haven't had to have any other services, because she has an awesome medical team. And she had me, of course, and we work together. We worked together to make sure that she had everything that she needed to continue to, live as long on this earth as long as she can.
Yes. It sounds as though she's still in her own home.
She's still in her own place. She
wonderful.
actually is, she lives in an independent senior building. Yeah, she's still in her own place. And I've made that promise to her that we're going to keep her there as long as we can. And so has our medical team. Because I've heard, and even her medical team has said to me that, it's better for them to be in their own spaces. Anyone, when you're, you're having health issues, or, you're getting older, it's their comfort zone. It's what they're familiar with, and it helps them to, to live as long as they can.
Definitely. I want to go back to what you said about how she felt when you had to go to DHS and apply for different things, because I can definitely understand that. As African-American Black people, that's something the working people that have worked for years and years and years do not want to do.
Yeah.
It's a challenge to get people to obtain services sometimes.
Yeah, she was not pleased when I told her we needed to do it. You know, and I just had to explain to her that, you know, she needed more care. And you know, her insurance, the current insurance that she had was not going to take care of her medical needs. You know, she wasn't happy about it, but in the long run, she understood.
Definitely.
Do you mind if I
And
jump in with just a quick follow-up question?
sure.
Or just, it's just an observation. So you mentioned the stigma about having to go to DHS, but then there's also the stigma of having dementia on top of that. So it
Mhm.
must have been doubly hard for her. That's what I'm thinking.
So yeah. And honestly, like my my mom does not really like because she has a dementia, like she's not really even aware that, you know, that there's something going on, right? Like she's not really even aware of that. You know, and that's just who she is. Like she goes through her day being happy, you know, and as long as she's fed, you know, like she
Like
told me
all of
today,
us.
yeah, like she told me today, I went to see her at the senior place for lunch to, you know, today, and she was just finishing her lunch actually, and she was eating some ice cream, and we were talking, and she was like, you know, I like to eat, right? So long as she's, you know, long as everything is put in place for her, you know, she's being taken care of, she's fine.
That is wonderful. That is wonderful. So, what challenges have you faced since she's been diagnosed and you have become her caregiver?
So I mentioned the biggest one. So now, you know, and that still sometimes is a challenge because she currently has now one. So she had 2 home health aides that had been with her for 14 years. One of them is no longer with her, who was her daycare person. And then her evening aide is now there. She's there 4 hours in the evening. And prior to that, the biggest challenge was really trying to find aides. And that's for a year and a half, I felt like I was going back to the beginning because we had daytime and then we had evening, and then it became she needed overnight. And so we pretty much started over with the system and trying to get her overnight care. Because one thing is, nobody gets 24-hour aid service anymore, right? And so, you know, trying to finagle and work with the system to say, you know, because then people would always say, clinicians, maybe you need to put her in a nursing home, maybe she needs to be in assisted living. But on the flip side of that, you keep telling me they'll live longer if they stay in their own space. And so that was my toolkit. That's what I argued. You keep telling me that she needs to stay home, that she, you know, she'll live longer if she's in her own space. But then you tell me maybe I should put her in assisted living. So which is it?
So you
And
had
I argued with them for a whole year. And that was my argument.
Wow. And see, that's so important, being an advocate, because if it was someone who was just out there on their own, they would have been put into a nursing home, you know, and the decline would have been more sudden. And also, you know, just she feels the love. She feels the love. She feels it.
Yeah.
You know, that's so important in this diagnosis.
Yeah.
So
It
important.
most certainly is. It most certainly is. And she said that even like today. So I just, you know, I decided, yeah, I think I'm going to go and see mom today. And so she said that, and that's exactly what she said. Like you can see that the smile on her face, you know, when I walked in the room, and even when I visit her at home, you know, it is all about them feeling the love.
Yes.
And what I have learned since all of this is that, and I say this to people all the time, like, I'm in her world now.
Explain that a little further to people.
So there are times when I may go to my mom's house and she will say, she has on her, you know, her duster, and she's been home all day. And I may walk in and she'll say, "Oh, I just got home." And I'll be like, "You just got home? You did? Where you been?" You know, and she'll say, "Oh, I had to go pay some bills, you know, or I had to go to the grocery store, or, you know," and I just follow through. I just follow up with her. You know, one day she told me I just go with the flow. You know, one day she told me that she had moved into another apartment, right? And she's sitting in her lounger chair, right?
Yes.
And I was like, "Oh, you moved into, where did you move to?" And she was like, "Downtown." And I was like, "Oh, you did? When did you move down there?" You know, so I just go with the flow with her. And that's what I mean when I say, you know, I'm in her world. I don't, sometimes depending on what it is, you know, I may say, "No, Mom," you know, and even when I say no, like sometimes I try to help her to remember things. And so I'll sit in front of her face to face and say, "Remember when? Remember when I told you that this happened? Or remember when this happened? Or you remember the other day and I was sitting here and we had breakfast together," or, you know, those kinds of things. So, and sometimes but when she's in her own world, you know, and just thinking about, and I think, I think, you know, a lot of it is just, you know, she thinks about a lot of the things that she did before. And so, you know, like, if you start a conversation with her about a hospital or a doctor, her face lights up because she remembers she worked in that space. And so, yeah, I just go with the flow with her.
It's wonderful. And once it goes back to her feeling the love, so important. But how do you deal with yourself, keeping yourself, your stress level at a minimum, which is so hard with our daily lives, let alone having to care for a very close loved one? What does Jackie do to take care of Jackie?
So let me tell you, it wasn't easy. I was angry in the beginning. And it wasn't anger. It was anger at my mom because I felt like I was losing her. And so I had to figure out a way. And this is before I started saying I'm in her world, right? All of this was before that. Because every day I was running to the store because she would call me and say she needed something. And then when I say every day, literally every day, because I was also trying to make sure that she was okay. But in doing and having to do all of those things, I was angry. I was mad. I was, you know, I had an attitude. And I had to go talk to someone, you know, because it was a lot in the beginning and it was something new, and that I just didn't know, because I work a lot. And so I was having to fit her in now. And it wasn't an easy thing to do.
I understand.
Yeah.
I definitely understand. Well, I want to mention at this point that the Alzheimer's Association does have support groups,
Mhm.
and people that are dealing with the same type of stresses concerning being caregivers to loved ones, they
Mhm.
can join support groups to engage with others that are dealing with the same type of situation. So
Mhm. Thank you.
definitely, whoever needs the assistance, reach out to the Alzheimer's Association.
Yeah, thank you very much. And I appreciate that. And I will say that I do have you all on speed dial because again, I'm familiar with the organization. I support the organization. I've just been fortunate enough that I haven't really had to use any of the services, but I also I still attend any presentations that that you do. So I volunteer. I do the walk.
Wonderful.
I am um, I am attentive to the services that you provide. Um, and again, like I said, I've been fortunate that my mom is able to sort of have one-stop shopping, and I am in a place now where I don't have an attitude anymore. Like I said,
Wonderful.
I'm in her world. And so I've learned to balance. And there were times when I would never say no to those every day going to the store for my mom. And so I've learned that it's okay for me to say no. If if I can't do something for her in the moment when she's asking for it, as long as I know that she's okay, she's fed, she's clean, she's, all of those things. It's okay for me to take time for myself.
Yes. And I understand, as African Americans, it's hard for us to say no to our parents and elders,
Yeah.
because they've given so much to
Yeah.
us.
Yeah.
But I understand that, there are times where you're
Mhm.
going to have to
Yeah.
say no. And I'm glad that you found that balance.
Oh,
I'm
yeah.
glad that you found that balance.
Thank you.
But what suggestions would you give to other caregivers as far as seeking assistance and resources in dealing with the daily stress of having a loved one that's suffering from Alzheimer and other dementias?
So honestly, I'd say reach out to the Alzheimer's Association. I most of the time I tell my story and talk about the connections that I was able to make and how I got through the systemic portion of trying to get services for my mom. So my story is, I'm always telling my story because I think our personal stories always helps others, right? Because we always have someone who can relate to our own stories. We don't think we do, but we do, because we always think that we're the only ones, that may be going through something. So my advice really is to, one, don't stop. Like if you need services, turn over every stone.
Yes.
Turn over every stone until you get what you need, because the services are out here. They are out here, and it's really about, finding the right resources. Challenges, there's always going to be challenges because our system is just built that way.
I agree.
So there's always going to be barriers. But keep searching. There's always also going to be somebody that can lead you in the right direction.
Yes, yes. And it's good that you're sharing your story, with
Mhm,
people,
mhm,
because
mhm,
people need to be heard. And
mhm.
sometimes they feel that, others won't understand them
Yeah,
if they're not going through that same situation.
right,
So it's
right.
wonderful that you share your story.
Yeah, thank you. Thank you.
Definitely. So I want to know, what are some
Uh-oh.
things that make you smile? What makes you smile when you see your mom? Which
Just
she tells
seeing
a
her.
couple of stories, so it's pretty entertaining, I'm sure.
Just seeing her. Um, honestly, just seeing her. Like I hadn't seen her all week. And so today I woke up this morning, I was like, I need to set my eyes on my mom.
Yes.
And so I called the center because they still have, COVID restrictions. And I called the director and said, I want to come in and sit with mom for a little while
Mhm.
today.
That's wonderful.
And she made
That's
it happen. And, when I walked in, her face lit up, my face lit up.
wonderful.
Um, yeah. So, and also um, sharing, what my week has been, what, if I've gotten new photos of my grandchildren, I share those with her.
Mhm.
Hearing and knowing that my daughters have, like she told me today, like my daughter called her, both of my daughters this week, she heard from them. They both live out of town. And and just what makes me happy is just knowing that she's okay.
That's wonderful. That's wonderful. There's nothing else to be said about it except that is wonderful. And I truly believe and I live by not living with any regrets. And you
Mhm,
have done everything possible to make sure she's safe, secure, and feeling the love
mhm.
still.
Yeah,
So
yeah.
that's pretty awesome.
Thank you.
It's
Thank
pretty
you. Yeah.
awesome.
And I
Yeah.
feel pretty good about it because I know, again, like I know that um I've I've done as her daughter, like I know that I've done what I'm supposed to do by her. So
That's wonderful. And I'd like to thank you again for joining Velvet and myself to talk about how it is to be a caregiver to someone who's living with Alzheimer's disease. I'll turn it back to Velvet now. Thank you, Jackie.
thank you so much, Cynthia.
You're
Thank you,
welcome.
Cynthia. And thank you so much, Jackie, for telling your story. I'm so happy that your mom is still in a good place and
Yes.
that you're able to sit together and chat and do all of, or most of the things that you've always done together. I think that's wonderful.
Thank you.
And thank you for mentioning the Alzheimer's Association. I just want to let our audience know that we offer hundreds of programs and they're free. And we have support groups all over the 10-county region that we cover. And we also offer care consultations. So you can call our 1-800-272-3900 helpline anytime, day or night. We have a person available that you can chat with, and we can set you up with care consultations and set you up with the support you need in your area. And you can visit us at alz.org/Rochester NY. Cynthia, you want to talk a little bit about your organization before we go?
Thank you, Velvet. So Rochester Health Engagement Partners was formed 15 years ago. We'll be celebrating our 15-year anniversary in
Wow.
October. Yes, Jackie.
Congratulations.
Thank you. Thank you. Thank
Wow.
you. Yes, ma'am. So we're pretty excited about that. And I should let you know, as I let everybody know, that the Rochester Health Engagement Partnership was formed by 4 African American women.
Yes, I
Yes,
remember. I
yes.
remember.
Because what we kept hearing in the community was, we want someone who looks like us to
Mhm,
speak to us.
mhm.
So we formed it 15 years ago. I have the approval of my former founders to continue the program or the initiative. It's now incorporated.
Yeah.
And that's what I'm doing. So if you need any seminars, presentations regarding different health topics, please reach out to me.